Hello everyone, this is Dr. John Makoff here. I thought I would share an interesting case I had last week. So I had a patient come in who I hadn't seen in a few years with some hip pain, right hip pain, and she has high pain tolerance, and of course she's been dealing with for quite a while. And she went through some physical therapy, some pelvic floor therapy, all helped a little bit, but it wasn't getting better. So she reached out to see me. She came in, and we started to evaluate it. So what I first went through is evaluating the muscles and the myotomes, which is the nerve connections, the nerve root connections to the muscles, and to see how that communication was, and seeing what muscles were inhibited, what muscles may be, which is like not weak, it's not connecting, not getting that feedback of information. And then seeing if there are any of the muscles that are overprotecting, over-facilitated, like even when they're supposed to relax, they don't. So they're usually protecting something. So on her right side, almost all of the muscles on her lower right side, body, quads, hamstrings, piriformis, hip flexors, glutes, even down to the feet were inhibited. Didn't mean they didn't work at all. It wasn't a paralysis. It just was not able to function on demand in coordination with the other muscles as you demand it. So left side was a little bit better. Not everything great, but a little bit better. So she has 2 children. She said she had a C-section for her first child 4 years ago-ish. She had a second child 2 years ago. And during the pregnancy, the nurse that was supposed to help her stabilize her in birth position, was not stabilizing her right hip that well. And so she was having to try to stabilize it herself while she was in birth, when she was in a vulnerable position, asking the nurse to help her a little bit better. And the nurse sort of snapped at her like she's doing the best she can, and find out later that she had an injury on her own. So it goes into the nurse's part of not being able to own her no and say, can't work, bring someone else who can. But don't know that situation, so that's its own thing. So not only was she not having her right hip stabilized during a very vulnerable time and a very vulnerable position, it actually adds some potential emotional trauma onto a physical trauma and strain that brings into the cellular memory of trauma being not only to the area, but to the area in that position as well. So we evaluate all the muscles, and then sometimes I have some intuition to things. And so I had her touch her C-section scar that she had since the first birth. And as soon as she touched that, all of the inhibited muscles on the right side turned back on right away. And what that told me was there's also the old injury of the C-section, because surgeons and OBGYNs did their job, sew everything up, you're not still bleeding out, your organs aren't coming out, so they're all done. But you cut all this information and traumatized all the neurology of that area and disconnected some of the planes of connective tissue from communicating correctly. So you left things undone, and potential issues to come down the road. And that can happen in any scar tissue, So your body works as a system. Anything pulling on something that takes away the information can create overworking or shutting down of certain muscles in various aspects of the body, anywhere. So So we saw that the C-section had an effect. So I used some radionics vials, which are vials that have certain energy that can be tuned to certain things that other people know how to do. And for the sensory system, we have vials for vibration, temperature, proprioception, pressure, light touch, deep pressure, form recognition, things like that. And so I used the infrared light with those vials and tested her body using muscle tests and frequency testing to see how the C-section scar reacted. And it initially shows that there was some trauma with it that we worked on until it strengthened. And then we also went to the manual aspect of the nervous system, of the sensory system, using little pinwheels over having her do it for herself, but having little pinwheels that are little prickly wheels to test the pain sensation, which again showed a sensory inhibition to the C-section scar. Worked on that with infrared light to stimulate the brainstem, and from some of this is from quantum neurology. A lot of it's from quantum neurology, developed by Dr. George Gonzalez, good friend. But also some of the radiox files is from another colleague, Dr. James Sheen, who's brilliant in his own right. And so I worked through that, worked through vibration over the C-section scar, worked through some pressure, some temperature of hot and cold packs to bring all this information back online, with her laying straight down, but I also did it with her legs in that birthing position and found more inhibitions to correct. After we were done, she got up and she was very shocked how much better she felt. And I love that because I love what I do, and I love seeing the results of seeing people that realize it's not just these physical structures of muscles and stuff. A physical pain doesn't always have to be with something you're directly touching. Even though the nervous system is an information pathway that is inhibited, reestablishing that information pathway in itself can help stabilize the muscles and turn them back into functional units and functional system. So yes, I find this stuff fascinating and love it, and I see it all the time, but I thought I would share this. And any questions, feel free to leave in the comments, or if you have any questions, want to schedule something, ring a bell with you, just either private message me or contact me through my email below. And hope everyone has a great week.